morning. My name is Jonna Warden. I am a nurse practitioner student, and today we're going to be doing an exam focused on your heart, lungs, and peripheral vascular system. Does that sound okay?
Yeah.
Okay. I have your name is Tristan Warden.
Yep.
And your birthday is 1/26/96?
Yep.
Okay, good. So for general survey, Tristan is a 29-year-old healthy appearing male sitting in the upright position. He is well groomed and dressed appropriately for the situation. He appears to be in no distress and is alert and oriented ×4. He is the primary historian for his care, and his vital signs include blood pressure 129/82. His heart rate is 88 and regular. Temp 98.1. His respirations are 16 and he is on room air. His height is 6'1". He weighs 300 pounds and he rates his pain as a 0 on a pain scale from 1 to 10. Alright, I'm going to wash my hands. And we'll get started with the exam. Alrighty, so the first thing I'm going to pay attention to when I'm looking at Tristan is any signs of respiratory distress. His rate and rhythm are normal and within defined limits, and there is no sign of work of breathing. And then we're going to look for his color. I don't see any signs of cyanosis or pallor. Those things would be noticed in his mucous membranes, his lips, his fingernails, and toenails. And while I'm doing this, I'm listening for any audible wheezing or any kind of audible adventitious breath sound, and I do not hear any. Next thing I'm going to assess is your trachea, so I'm going to put on some gloves for that. Tilt your chin up for me. Good. Follow for me. Good. Trachea is midline and I don't feel any nodes or anything like that. Next, I'm going to be assessing your jugular vein, so I'm going to have you lay back for me. And what I'm going to have you do is I'm going to have you turn your head that way. Good. Just going to feel for your sternal notch here. Okay. A little measuring tool here. Okay. And based off of that measurement, I am observing carotid pulsations, and the measurement is 7, which is considered normal. Now I'm going to have you come up to a seated position for me. And again, while he's doing that, I'm looking for any breathing irregularities. And his anterior and posterior thorax are moving symmetrically and bilateral, and I don't see any appearance of any deformities or any scarring while I'm there. Now I'm observing the AP diameter versus the lateral diameter. His AP is wider than it is deep, which is an expected finding, and it's about 0.7, which again is considered normal. Next, I'm going to just take a quick peek at your extremities. I'm going to start with your upper first. I'm looking for any edema, any clubbing, any cyanosis. I'm going to check your capillary refill. Good. Check this one. Arms are symmetrical. I don't see any signs of clubbing in his fingernails or swelling. Temperature is warm. And cap refill is less than 2, which is in defined limits. So I'm going to start down here. I'm going to check for any swelling. No swelling. Temperature is normal. Cap refill is less than 2. Come on this leg. No evidence of any edema. Cap refill is less than 2. And everything looks good on all 4 extremities. Now we've done the inspection part of the exam, we're going to start palpating. The first thing I'm going to check is your carotid pulses. I'm going to check them one at a time, and then we're going to move on to your brachial and your radial pulses, okay? Good. Carotid pulses are equal bilateral with +2 with a smooth contour and quick upstroke bilaterally. Now I'm going to check your brachial pulses. Good. You do not have to pump your arms for the exam, sir. Good. And carotid, brachial, and radial pulses all +2 equal bilateral. Next thing I'm going to check is for, I'm going to kind of palpate and percuss on your chest. And if any point that you feel any pain or tenderness, please let me know, okay? Any pain or tenderness there. All right, I'm just going to take a quick peek down in here. For modesty purposes, we're going to keep him mostly covered. And I don't see any bruising on the chest either. And while I'm here, I'm going to assess your anterior chest expansion, and then I'm going to have you turn around and we'll do the back side. So I'm going to come in right here. And I want you to take a deep breath for me. Good. One more time. Good. Anterior chest expansion is equal and bilateral, so I'm going to have you stand up for me if you don't mind. Turn around. We're going to do the same thing on the back. Good. Perfect. Now you can have a seat. Posterior chest expansion is equal and symmetrical. And this is where I'm going to have you lie in a left lateral position, so I want your head down there for me. And while I'm here, I'm going to assess for your point of maximal impulse. This is the 5th intercostal space on the left side, mid-clavicular line. So I'm having you put your arm like this for me. Good. This arm like that. Good. So 5th intercostal space, mid-clavicular line. Good. Very good. I can feel the point of maximal impulse. And it's about 2 centimeters in width. Now we're going to flip onto our back. We're going to be supine again. Thank you. And while we're here, I'm going to be feeling for any aortic arch pulsations. I'm feeling for the right side second space. I don't feel any aortic arch pulsations. So then I'm going to move over to the left for the pulmonary artery. Good. I do not feel anything there. No impulses felt. And now I'm going to make my way down to the 3rd and 5th space on the left side to feel for any right ventricle impulses. All right, no impulses felt. So I'm going to have you stand up, and I want you to face the back for me. Sorry for all the gymnastics we're doing for this exam. And you turn around. We're going to check for tactile fremitus. So what I'm going to have you do is when I tell you, I'm going to have you repeat the word 99 for me, okay? All right. And what I'm going to do is I'm going to feel for any vibrations on your back. I'm going to put the ulnar side of my hand on your back. All right. I want you to say 99. 99. Okay. 99. 99. 99. 99. 99. 99. 99. 99. Okay, very good. I didn't feel any increasing or decreasing vibrations when we did that. All right. And while you have your back to me, I'm just going to percuss your back, okay? You're just going to feel me beating on it, okay? All resonant sounds in the lungs equal bilaterally both sides on posterior side. So I'm going to have you turn around and sit for me. So we're going to do your anterior chest next. All equal in resonance on your anterior chest. And while here, we're going to feel for any heaves or thrills. So I'm going to look for your third, fourth, and fifth intercostal space. I'm going to actually have you lie down for this one. Again, sorry for the gymnastics. Thank you. Okay. No heaves or thrills felt. Next, I'm going to listen to your carotid. I'm going to do one at a time. I'm listening for any bruise, okay?
Okay.
Tilt your chin back for me. Good. Good. I didn't hear any bruise upon auscultation of bilateral carotid arteries. Now I'm going to listen to your four heart valves. We're going to start with aortic. It's your second right intercostal space. Very clear. Good. Move over to pulmonic, which is the second space on the left. Good. I'm going to work my way down and listen to the fourth intercostal space for your tricuspid valve. We're going to listen to your mitral valve. And then I'm also going to flip to my bell and listen to your apex as well. Very good. All right, you can go ahead and sit up. S1 and S2 were clear. That's your lub dub. I didn't hear any S3 or S4, which would be extra heartbeats. And everything looked nice and clear when we listened to that. Now I'm going to listen to your lungs next, okay? I'm going to do your front side first. Your anterior portion. Very good, thank you. Take deep breaths for me. I want you to breathe in through your nose, out through your mouth. Good. Lung sounds all present and clear on the anterior front. I'm going to have you stand up for me and we're going to listen to your posterior sides. Okay, deep breath. Okay. Good. Okay. Okay. Deep breath. Okay. And one more. Okay, very good. You can have a seat. All lung sounds on the posterior front are clear, equal, and bilateral. And then finally, we're going to get to the peripheral vascular portion of our exam. So first I'm looking at the upper extremities again. I'm gonna take your arms here. No swelling, no distinct venous patterns. Color is pink and normal. Temperature is warm as it should be. Same on this side. We checked our cap refill earlier. We know that is less than 2. Next, again, I'm going to feel the pulses of your upper extremities like we did earlier. We're going to listen to feel for brachial and radial. Okay. Please. Okay. All pulses are +2, equal bilateral. Next, I'm going to have you kind of put your arm up like you're flexing your muscle for me. And I'm going to feel for any epitrochlear nodes. Okay. Thank you. Okay. No epitrochlear nodes felt. And we're going to move on down to your lower extremities. Again, we've already checked these, but there's no swelling. Temperature is warm and pink. No evidence of any swelling, like I said, and everything is symmetrical on both sides here. But now I'm going to start to feel for your pulses, okay? I'm going to feel for your pulpitile first on over here. Very good. All right. Posterior tibial. Okay. Posterior tibial. Good. Dorsalis pedis. Good. Good. All over extremity pulses are +2, equal, and bilateral. Then I want to have you lay back, and we're going to feel for your aorta. So lay back for me. Now for this portion of the exam, I am going to have you lift your shirt for just a second. Okay. I'm going to feel for your aorta, feeling any pulsation. So I do not feel any pulsation, which is normal, and the aorta is about 2.5 centimeters wide, which is in defined limits. Then I'm going to just listen to your aorta, or I'm going to listen to your carotid bruits, renal bruits, and femoral bruits, okay? Good. Good. And then I'm going to quickly feel for your femoral pulses, and then I'll listen for any bruits while I'm here. Good. Femoral pulses are +2, and then I'm just going to feel for any bruits here, or listen for bruits. All right, very good. You can have a sit up for me. Alrighty, we finished our heart, lung, and peripheral vascular exam. Thank you for your time.